Today's video, we're going to talk about xerostomia, and you might know it more as chronic dry mouth. So roll that intro and let's start the discussion. What's up, everyone? Dr. Eric Jackson here. Hope you're doing well. Wanted to jump on real quick today, and we're going to talk about xerostomia, the fancy proper term for chronic dry mouth. Xerostomia is often induced. It can be induced by a multitude of different things, but the top two that I typically see would be a genetic component. Just having that's just the way your body it ages, it turns into that. But the number one, however, is usually a medication or prescription induced condition. One of the top side effects of many medications out there, doesn't matter, multiple different classifications, is dry mouth or chronic dry mouth. Now, I always advise whenever somebody comes in, we check for, to their hygiene appointment, we check salivary output, because without saliva, dental care becomes much harder. Saliva is very important. It has multitude of different uses. It pH balances, it lubricates, it helps to wash away food particles. Like I said, it's an acid balance. It's an acid-base balancer, a pH balancer. When you remove saliva from the mouth, cavities can become very rampant. The mouth become very sore. It's dry. It's like a desert in there. It's rough and pebbly instead of smooth and sliding around. Things just don't work right without saliva. What can you do if you have one of these conditions, this condition of xerostomia? Well, the first thing is speak to your medical doctor about it. They're typically, the medical doctor is the one who he or she's giving you these prescriptions. And I'm not saying that you need to, and certainly don't come off of them in any way, shape, or form without approval from your medical doctor. But talk to the medical doctor. Say, hey, I just don't have any saliva. I'm really suffering. My dentist has noticed it too, compared to my past visits. Is there something we can change? Maybe there's a different medication out there, an alternate medication that'll accomplish the same goal but won't have as much impact on your body chemistry. Perhaps a dosage change might be in order, and perhaps nothing. Perhaps you need that exact medication at that exact dosage, and that's the way it's going to be. Well, that's fine. That happens to many people. What can you do after that? Well, there's plenty of things you can do. The first thing is make sure you're drinking enough water. You'd be surprised how many people with chronic dry mouth, with xerostomia and the medications and things like that, well, they're not drinking a decent amount of water per day. You can't make saliva if you're not intaking water routinely, especially if you're being induced to be drier than normal. So keep your water intake high, because that way your body will have plenty of liquids to create its saliva from. To help you with that, I always recommend xerostomia patients walk around with a little water bottle, some sort of way that they can consistently sip. It can be, you can have an Nalgene, you can have a Yeti, you can have a traditional sports bottle. Doesn't matter. You can fill your coffee cup with water. That's just fine, as long as you're trying to always drink. Now, there's also discussions about, should you drink 8 glasses at once, or should you try to space it out? Well, I always try to recommend you space it out if possible. But then again, every day is not the same. You might see what works for you. Drink a glass or 2 in the morning if you can, to get your body started, and then you can kind of supplement throughout the day. It'll help to moisten the tissue. It'll help to maintain that hydration all throughout the rest of the day if you're doing it a little bit at a time. Let's talk about breathing. Breathing through the nose versus breathing through the mouth. Breathing through the nose is how your body is intended to breathe. Now, that's not always possible with everybody. Deviated septums, allergies, etc. Lots of reasons why people breathe in and out of their mouth. But with that said, aim for the nose. Try with the nose. And if you have dry mouth, keep your mouth closed and try to do more nose breathing. That way, you're going to be able to maintain the humidity, stop, especially in the drier months. If you live up here in Chicago, winter is very, very dry, of course. And you'll have a lot of cold, dry air in and out of the mouth all the time. It'll dry you out much faster than if you kept your mouth shut. Along the same line with dry air, don't forget about a humidifier or a vaporizer in your room, especially in your bedroom. It'll help to moisten not only just your nasal passages, but everything's connected, right? Keeping things moist, keeping things nice and lubricated internally as well is very important. Finally, over-the-counter products like Biotene, saliva replacement products. Biotene is a fantastic product. It coats. They have different material, different forms of Biotene now. They've got gels, they've got rinses, they've got all sorts of different things. Take a look in your the dental aisle. You can peruse that and see what works best for you. Ultimately, I always advise patients start with the easy, prevalent, and inexpensive things, the water-based items, keeping things up. Then you can start purchasing Biotene as needed. It'll also reduce the need for Biotene as much if you're doing the previously mentioned items first. If you have dry mouth, you don't have as much saliva, well, what about your dental health? What tips should you do? Well, you got to avoid, first of all, you need to avoid certain sticky, acidic foods. Anything that's going to cause cavity is going to work much faster in a drier environment. So you need to make sure that you try to keep an eye on your diet. Those gummy, atomic, sugar warheads, candies that get jammed in the grooves of your teeth, they're going to be multiple times more detrimental to your teeth without saliva. And in general, try to avoid those in general. Brushing, flossing, rinsing, oral hygiene as a collective, super important with a dry mouth. You also are probably going to want to up your ante. You're going to need to use better tools. So I always advise for everybody, consider electric toothbrushes, consider a water flosser, things like the Sonicare Air Floss. But you're going to also probably want to turbocharge your rinsing. A good fluoride-based. Fluoride is going to be your friend because it helps to prevent and counteract some of the damage caused by the acids in the mouth. So a good fluoride-based rinse, like my favorite being Listerine Total Care Zero, zero alcohol in it. I love that for the whole family. It kills bacteria. It introduces fluoride to the teeth and to the enamel, and just overall protects. But I often, in addition to the Listerine Total Care Zero Alcohol, I'll prescribe prescription toothpaste like Prevident 5000 or ClinPro 5000. Both of those introduce a tremendous amount of fantastic fluoride to the party, and it really helps as much as you can to counteract this. Even with that said, sometimes things are so dry, it's a hard uphill battle. But if you control the water intake, if you do each layer, water intake, humidifiers, breathing through the nose, dietary checking your diet, maintain good oral hygiene, use super toothbrush, super toothpaste, excellent flossing and brushing. If you really knock it out of the park on a lot of these aspects, you've got a pretty good chance of mitigating this condition. And I didn't mention, of course, this is all after speaking to your medical doctor about the most likely cause being the prescription that you're taking or prescriptions that you're taking. So if you have any further questions about xerostomia, please feel free to reach out, comment below. We love when patients and non-patients alike comment. Always great questions produced on all our different avenues of social media channels. If you like the video, please hit the like button. Subscribe to the channel. We appreciate that very much. When you do so, hit the bell so that way you can be notified whenever I upload a new video. It'll pop up right on your phone. In the meantime, thank you so much for watching. I'll see you in the next video. Have a great rest of your day. Bye now.